So I changed my mind. I've decided that I'm going to do the CPR video now, but I'm not going to do the demonstration until I can freaking, like, hog tie my cousin and make him sit still for long enough to do so while I'm, like, awake and coherent, because, like, he seems to be ready for action anytime I'm not, basically. So this is the adult CPR video. Um, Now, I'm using the same site that I've used for all the other videos, which is only two of them. But it says, first of all, and I want to make this clear, because I know this for a fact, that there is no substitute for actually training and learning CPR, which stands for cardiopulmonary resuscitation, in case I didn't mention that in the other videos. And even if I did, just so you know. But at the same time, in case of emergency, obviously you don't have time to go get trained real quick. Um, Now, this is again, it's for conventional adult CPR. So, if you've never been trained before and the victim has collapsed right in front of you, then you probably shouldn't try this one yet. It says it has a different one called hands-on or hands-only CPR, which I've never actually heard of in my life. So maybe I'll do a video on that too, considering it's still a part of the CPR family. Um, but not every CPR class is the same, and there are CPR classes for healthcare professionals, as well as CPR classes for for anyone, pretty much. Um, all right, so it's pretty easy to perform CPR, or it's supposed to be, once you know what you're doing. Which I mean, that I don't even know why they say that, because everything is supposed to be easy if you know what you're doing. But step one, of course, again, as I mentioned in both the other videos, is stay safe, because the worst thing that can happen in this situation is for the person who's trying to rescue the victim, or you, assuming that you're the person trying to help someone, to become another victim. In other words, if you're trying to help someone, you end up endangering yourself instead, because then you need somebody to come help both of you, and that just makes things even harder. Now, you should follow universal precautions, which um, I guess include washing your hands, wearing gloves if possible, wear a full body gown if possible, which, I wouldn't imagine anybody to have this stuff on hand unless they're like a nursing student or a nurse or a doctor or like some sort of medical personnel. But like a full body gown and stuff, wear a face mask, an eye protector, and dispose of all contaminated sharp objects, dispose of all contaminated personal protective equipment. Um, and you're supposed to dispose of these things in a appropriate, puncture proof for the sharp objects, but appropriate container marked for biohazardous waste. Um, so, yeah. This might have to be a two-part video. Um, you should wear personal protective equipment if you have it. That includes, again, hand cleaners, gloves, CPR mask if you have one, face mask, which I don't even understand why you would want to wear a face mask if you're trying to give CPR, because if you're wearing a face mask, then your mouth can't get to the other person's mouth, so how does that make sense? But eye patch, I don't understand you need an eye patch for CPR, but that's one of the types of safety stuff, basically. Um, eye patch, eye protection, some form of eye protection. So I'd say goggles would work better because at least you can see. Uh, you should have a sharps container for like stuff that's stabby, basically. And a gown and biohazardous waste containers. Again, like, sorry guys, I have it. It's underneath the laptop. Anyway, yeah, so if you have those things available, that is great. If not, I'm sorry. It's not like a requirement to perform CPR, but it sure is helpful. So you attempt to wake the victim. Since this is an adult, the you can be a little bit more rough. We're not like trying to shake the crap out of the person. We're not trying to like harm you, but since you're an adult, you can handle a little bit more abuse than a child can. So you can briskly rub your knuckles against the victim's sternum. Um, pat them on the back, shake them a little bit, like the rubby shake, not the shake. Like that's not cool. You don't just go, wake up! Like, that's not gonna help at all. You might give them whiplash or something if they're limp. But if the victim does not wake up, call 911 and proceed to step 3, which is the start of CPR. Now, calling 911, you should probably try and get someone else to call while you start CPR because the sooner you start CPR, the better. But if you're the only one there, I'm pretty sure you're supposed to start CPR first. However, usually that's what the other two said, and it is the same site, so I don't understand why they wouldn't say it this time. But they don't. But that's my suggestion. That's my opinion. You know, I guess it could go in either order, but it makes more sense to start CPR first, to me. If the victim does wake up or moan or move, then CPR is not necessary at this time. Just call 911 and um, call 911 if the victim is confused or not able to speak. I think that even if they can speak and stuff, you might end up having to call 911 anyway if they're in serious trouble. Like, they might need to check for concussion or some shit. At least if they're awake, you could try taking them to the hospital instead of calling 911. I would think that would make more sense because you had to wait for 911 to get, or for the ambulance and crap to get there when you could just hop in your car now and be on your way faster. But in the event that you have to perform CPR, also like before, if you are not sure if the person is breathing or not, assume that they're not. Now, check for the breathing. Um, tilt their head back, open their airway. Use the chin lift method, like the head tilt chin lift. Put your ears to the victim's open mouth. Look for chest movement. Listen for air flowing through the mouth or nose. Considering they're connected, it could be both. Feel for air on your cheek. If there's no breathing, pinch the victim's nose. Make a seal over the victim's mouth with yours. Use a CPR mask if available. Give the victim a breath big enough to make the chest rise. Let the chest fall, then repeat the rescue breath once more. If the chest doesn't rise on the first breath, reposition the head and try again. If it works on the second try or not, go to step 4. Begin chest compressions. That's step 4. Place the heel of your hand in the middle of the victim's chest. Put the other hand on top of the first with your fingers interlaced. Compress the chest about 1.5 to 2 inches or 4 to 5 centimeters and allow the chest to completely recoil before the next compression. Compress the chest at a rate equal to 100 per minute. I don't even know what the fuck that means. Whatever. Ignore that then, I guess. But it says perform 30 compressions at this rate. Now, anybody knows what the hell that means, please tell me. But basically, I'd say you should have about 30 compressions by the end of a minute, I guess. Now, you repeat the rescue breaths, open the airway, head tilt, chin lift. This time go directly to rescue breaths without checking for breathing again. Give one break, make sure the chest rises and falls, then give one breath, not break. Sorry. Remember, if the chest doesn't rise on the first breath, reposition the head before you give the second breath. And even if it doesn't work on the second breath, please start the chest compressions after the second breath. Perform 30 more chest compressions. Repeat steps 5 and 6, which are the rescue breaths and the 30 more chest compressions. Repeat those back and forth for about 2 minutes straight. After 2 minutes of chest compressions and rescue breaths, stop compressing and recheck the victim for breathing. If the victim is not breathing, continue chest compressions and rescue breaths. And keep doing so until help arrives. If you have access to an automatic external defibrillator, attach it to the victim after approximately 1 minute of CPR, chest compressions, and rescue breaths. Chest compressions are extremely important. If you are not comfortable giving rescue breaths, still perform chest compressions. It's normal to feel pops and snaps when you first begin chest compressions. Don't stop. You aren't going to make the victim any worse. Cardiac arrest is as bad as it gets. When performing chest compressions, do not let your hands bounce. Let the chest fully recoil, but keep the heel of your hand in contact with the sternum at all times. And if you need more information on these steps, please go to the Emergency Cardiac Care or the ECC guidelines from the American Heart Association. Now, I hope that was helpful. I'm going to do the next video, like I said. Well, I could even try doing it tonight. I don't really have a whole lot to do. I really kind of need to go to bed soon, though. So, hopefully that was helpful. And if you feel that you need more information on CPR via me, let me know. Thanks, guys. Hope this was helpful to you. And I will talk to you guys later. Ciao.